Hello everyone, I am Dr. Ekta Bhushan, teaching Anatomy and Physiology of Exercise at Indira Gandhi Institute of Physical Education at Sports Sciences, University of Delhi. I welcome you all to online lectures of CEC-UGC. In this series, we will discuss different topics associated with anatomy and physiology of exercise. But today in particular, we will discuss the topic posture and posture deformities. So, posture is defined as the attitude assumed by the body either with support during the course of muscular activity or as a result of the coordinated action performed by a group of muscles working to maintain the stability. And we have two types of postures, static and dynamic. Static posture is how you hold yourself when you are not moving, like when you are sitting, standing or sleeping. Body segments are aligned and maintained in fixed positions. This is usually achieved by coordination and interaction of various muscle groups which are working statistically to counteract gravity and other forces. On the other hand, dynamic posture is how you hold yourself when you are moving, like when you are walking, running or bending over to pick up something. It is usually required to form an efficient basics of movement. Muscles and non-contractile structures have to work to adapt to changing circumstances. It is important to make sure that you have good dynamic as well as static posture. The key to good posture is the position of your spine. Your spine has three natural curves at your neck, mid-back and low back. Correct posture should maintain these curves but not increase them. Your head should be above your shoulder and the top of your shoulder should be over the hips. You can see this is the standing posture. You can see in the picture, one is the poor posture, one is in the middle you can see the good posture and another is a poor posture. It's all about the curves. So although quite standing appears to be static, modern instrumentation shows it is to be a process of rocking from the ankle in the sagittal plane. In sitting, we can see the pictures of wrong postures as well as the right postures also. So, sitting requires the buttock resting on a more or less horizontal structure like a chair or a ground. Special ways to sitting are with the legs horizontal and in an inclined sitting. In lying posture also, we can see the bad postures and the good postures. When in lying position, the body may assume a great variety of shapes and positions. The following are the basic recognized positions. One is spine position, lying on the back with the face up. Then prone position, lying on the chest with the face down. Then lying on either side with the body straight or bent curved forward or backward. The fetal position is lying or sitting curled with limbs close to the torso and the head close to the knees. Now we can see the posture assessment. You can see in the picture also there is a vertical line which is dividing our body and which is crossing our body from head to toe, and we can see all the curves also, the cervical curve, thoracic curve, lumbar curve, then and how this vertical line is straight and crossing our body. So, the key to good posture is the position of the spine. The spine has three natural curves at your neck, mid, upper back and lower back. Correct posture should maintain these curves but not increase them. Your head should be above the shoulder and the top of the shoulder should be over the hips. Now, in an ideal posture, the line of gravity should pass through specific points of the body. This can simply be observed or evaluated using a plumb line to assess the midline of the body. This line should pass through the lobe of the ear and the shoulder joint, the hip joint, though the greater trochanter of the femur, then slightly anterior to the midline of the knee joint, and lastly anterior to the lateral malleolus. Then when viewed from either the front or the back, the vertical line passing through the body's center of gravity should theoretically bisect the body into two equal halves with the body weight distributed evenly between the 2 feet. Now, posture and health. So, misline your musculoskeletal system or increase pressure on the spine, making it more prone to injury and degeneration, then causes neck, shoulder and back pain. It also decreases flexibility if you have a bad posture and affect how well joint move, affect balance and increase risk of falling, make it harder to digest food, then make it harder to breathe also. Then there are common postural deformities which are spinal curvature. It has 3 deformities, then flat foot, knock knees, bow leg and round shoulder. Let's start with spinal curvatures. So, in spinal curvature deformities, we have 3 types of deformities. One is lordosis, kyphosis and scoliosis. So, this type of deformity is related to spine. This deformity is caused by carrying excessive weight beyond the capacity. In other way, we can say that weak muscles cause the deformation of the spine curvature. So, spinal curvature have 3 types of deformity which I have just told you, that are kyphosis, lordosis and scoliosis. So, let's start with kyphosis. In the picture also you can see the unaligned curvature of the spine, and you can see the kyphosis spine and the normal spine also, and where you can easily differentiate between this deformity. So, kyphosis implies increase or exaggerate of a backward or posterior curve or a decrease or reversal of a forward curve. It is also round upper back, depress of chest is common in kyphosis. So, these are the causes of kyphosis. Kyphosis is caused by malnutrition, illness, crowd deficiency of pure air, insufficient exercises, rickets, carrying heavy loads on shoulders, unsuitable furniture, weak muscles and habit of doing work by leaning forward, etc. So, these are the causes of kyphosis. Then we have some remedies. So, you have for remedies you have to sit in a chair. Your buttock should touch the back of the chair. By looking upward, hold your hands each other behind the back in such a way that your shoulders may remain in stretch backwards. Remain in the position for some time. Always keep a pillow under your back while sleeping. Bend your head backward in standing position. Perform the Dhanurasana, the yogic asanas regularly. Lie down in front, a lying position. Keep your hands near the shoulders. Now straighten up your arms slowly. Raise the chest. Head should be backward. Maintain the position for some time. Hold your arms out at shoulder level and bend elbows. Snap elbows back, return to starting position. Repeat this exercise at least 8 times for the best results. Here we can see some of the exercise which are very effective as far as the kyphosis deformity is concerned. You can see in the picture, the most of the yoga asanas, you can see the snake pose, the bhujangasana and cat pose, then Uttarakhand Utkrasht Asan, and you can also have some kind of cages also which you can wear and cure this kind of deformity. Now let's start with the lordosis. Lordosis deformity is the deformity of your back, and lordosis is inward curvature of the spine. In fact, it is an increased forward curve in the lumbar region. It creates problem in standing and walking. The body seems to be stiff. The individual feels shame and inferiority. Lordosis can be corrected in an early stage. So these are some of the causes of lordosis. Balanced diet should be taken. Obesity should be kept away, especially in early age. The body should be kept straight while carrying weight. Excessive intake of food should be avoided. Now we have some remedies for lordosis. From standing position, bend forward from hip level. Repeat this exercise 10 times. Then lie down your back, raise your head and legs simultaneously for 10 times. Perform sit-ups regularly. Halasana should be performed regularly. You should lie down in supine position, example on your back, then should raise your legs at 45-degree angle. Remain in this position for some time. Toe touching should be performed for at least 10 times. Sit down and extend your legs forward. Try to touch your forehead to your knees. Repeat this exercise 10 times. So these are some of the exercise from which you can cure your lordosis. These can help you, and most of the yoga asanas are meant to be strong, meant to strengthen your core muscles, which is the main reason of lordosis and any kind of supine deformity. Now let's see the scoliosis. You can see in the picture also your spine become a S shape in this scoliosis deformity. So postural adaptation of the spine in lateral position is called scoliosis. Scoliosis means bending, twisting or rotating. A simple or single curve to the left or convexity left is commonly called a C curve. Scoliosis curve may be found in S shape. So these are the causes of scoliosis: disease in the joint of bones, underdeveloped legs, infantile paralysis, rickets, etc. It may also be due to carrying heavy weights on one shoulder. Now let's see the remedies. Bending exercise should be performed in opposite side of C-shaped curve. Should be horizontal bar. Hold the horizontal bar with your hands and swing your body to the left and right side. To swim by using breaststroke technique. You can see some of the exercise shown in this picture. This is a plank position, then breaststroke is there, twisting your body left and right, and boat position, and you can see the one person is lying on the ball in a C shape kind of exercise. So these are the remedial exercises for scoliosis. Now flat foot. Our feet act as the base of support for the body in standing, walking, running and jumping. The curvature of the feet become flat in this kind of deformity. You can see in the picture also. In normal picture we can see the curvature in our feet, and in flat foot there is no curvature in the feet. So flat foot is generally found among newly born babies, but it becomes a postural deformity if it is still persists during lateral childhood. Causes of flat foot are: the main cause of flat foot is weak muscles along with the rapid increase in the body weight, improper shoes, carrying heavy weight for a longer period are also the cause of flat foot. Now we can see the remedies of flat foot: walking on heels, walking on inner and outer side of feet, wailing on toes to perform up and down the heels, jumping on toes for some times, to skip on rope, to perform Vajrasan, the yogic asanas. Now you can see the remedial exercise or remedies. You can start skipping, walk on toes, or you can have a kind of sole which is curved, and when you wear this kind of sole in your shoes, the muscles can accommodate, and you can create the curvature in your foot as well. The next deformity is knock knees. The knock knees are one of the major postural deformities. In this deformities, both the knees knocked or touch each other in normal standing position. The gap between angles goes on increasing. You can see in the picture also there is a Q angle in women, and when it increase in from normal, it become the knock knees. In knock knees, you can see the normal picture also and the abnormal picture also. So knock knees, the causes of knock knees are: the lack of balanced diet, especially vitamin D, calcium and phosphorus is the main cause of knock knees. It may also be due to rickets, the chronic illness, obesity, flat foot and carrying heavy weight in an early age may be other possible causes of knock knees. So remedial exercises are: horse riding is the best exercise for remedification of this deformity. Perform Padmasana and Gomukh Asana regularly for some time. Cord lever may be beneficial in reducing this deformity up to some extent. Keep a pillow between the knees and stand erect for some time. Use of walking calipers may also be beneficial. In severe cases, you should consult the doctor. So these are some kind of remedies and exercises. As far as knock knees are concerned, you can wear these kind of cages and these kind of exercises to cure knock knees. Now let's start the opposite of knock knees, which is bow leg. Bow legs is also postural deformity. Approximately it is opposite to knock knees position. If there is a wide gap between the knees when standing with feet together, the individual has bow legs or genu varum. This deformity can be observed easily when an individual walks or runs. Causes: the main cause of bow legs is the deficiency of calcium and phosphorus in bones. Long bones of legs become soft, hence they are bent outward. The chances of bow legs also increases when the children becomes overweight. This deformity may be because of the deficiency of vitamin D, improper way of walking, and forcing the babies to walk at very early age may also lead to the bow legs. Now remedies: vitamin D should be taken in required amount, balanced diet should be taken, bow legs can be corrected by walking on inner edges of feet, walking by bending the toes inward. These are the remedies and exercises as far as the bow legs are concerned. These are the Dhanur Asana, you can see, walking inward of the toes, and you can tie up your legs from hip, knee and toes and stand for some time. So these are the remedies for bow legs. Now the question arises, why good posture is important? So this picture shows the importance of the good posture. The first importance is improve your memory and learning, enhance your well-being, boost your self-confidence, reduce chances of lower upper back pain, improves breathing, improves gaining health, and make you look taller and slimmer, enhance blood circulation, improve digestion, facilitates weight loss, reduce joint pains, increase focus and productivity. When we see these much of importance of good posture, then why will we not improve our posture? So how can I improve my posture in journal? So I have mentioned some of the journal points from which you can improve your postures. The first is, be mindful of your posture during everyday activity like watching television, washing dishes or walking. Then stay active. Any kind of exercise may help improve your posture, but certain types of exercises can be especially helpful. They include yoga, tai chi and other classes that focuses on body awareness. It is also a good idea to do exercises that strengthen your core muscles like plank and around your back, abdomen and pelvis. Then maintain a healthy weight. Extra weight can weaken your abdominal muscles, cause problems for your pelvis and spine, and contribute to low back pain. All of these can hurt your posture. Wear comfortable low-heeled shoes. High heels, for example, can throw off your balance and force you to walk differently. So this puts more stress on your muscles and harms your posture. Make sure work surfaces are at comfortable height for you, whether you are sitting in front of a computer, making dinner or eating a meal. Then how can I improve my sitting posture? So you can see the picture while this girl is sitting and working on laptop, and you can see the sitting posture is very straight, 90 degree, making a 90 degree of your spine as well as making the 90 degree of your knee also. So switch sitting positions often. Take brief walk around your office or home. Gently stretch your muscles every so often to help relieve muscle tension. Don't cross your legs. Keep your feet on the floor with your ankles in front of your knees. Make sure that your feet touches the floor, or if that's not possible, use a footrest. Relax your shoulders. They should not be round or pulled backward. Keep your elbows in close to your body. They should not bend between 90 and 120 degree. So Now we'll see how we can improve the standing posture. So you can see the picture in this picture, the person is standing. Stand up straight, keep your shoulders back, pull your stomach in and put your weight mostly on the balls of your feet. Now we have come to the conclusion. So it is important to make sure one have good dynamic and static posture. Just knowing how to correct posture is not enough to achieve a chance of actual habit. So bodies uses learned motor pattern to perform everyday activities. When we sit, stand, walk or move, our body follows previously learned motor pattern. If your body has learned to slouch, that's what it will do. Physiotherapist, while correcting and improving postures, though assessment and treatment techniques can lead to many positive health outcomes for you. I hope you understood all the postures, its deformity, their causes and remedial exercises, and how you can improve your postures. That's all for today. See you next time. Thank you.